So skin boosters is a hot topic. You see it all over TikTok. You're seeing it with Kim Kardashian. You saw it originally with Jennifer Aniston. And the question becomes, what are we doing that's real in the US, and what are people doing overseas? So overseas, there's something called PN and PDRN, so polynucleotides, polydeoxyribonucleotides. And these were historically injected because they were approved by the KFDA, which is as stringent as the FDA, as a sterile product. There in the US, there's 3 companies that are allowing us to use PDRN products, but they're not all injectable grade. So you want to make sure that it's going to have the same type of manufacturing that you have with an Allergan, a Galderma, a MERS. So you want to make sure that it's a proper sterility that's going on, especially if you're going to introduce something immediately post-procedure or you're injecting something into the skin. Currently, there's nothing that's allowed by the FDA, that's nothing that's gone through a trial that says that we can inject polynucleotides or inject polydeoxyribonucleotides into the skin. Those are the skin boosters. What has come down the pipeline is from the HA companies. So Allergan released something called SkinVive a couple years ago that was released overseas as something called Volite. In the majority of patients, you get a nice luminosity that occurs with the skin. So those patients who may be a little bit dull skin, somebody who has a lot of fine lines, rhytids, we saw some change. The side effect, unfortunately, has been probably based on injection technique as well as the product itself, because it's a cross-linked HA, is that you can get these little tiny papules that last for over a year. So we have a patient that we're going to be sharing with our colleagues that has, she's actually a physician assistant who is getting ready to be married, and she has been dealing with these bumps for now 13 months. So that's a disaster. The question becomes, can we use something like a polynucleotide or a polydeoxyribonucleotide to then just turn on our body to actually produce more collagen and elastin and to improve the overall luminosity? And that's what we're seeing so far. So I was blessed to be part of a 5-person group. It's an international group. We have a doctor that's from Australia, from Korea, from Thailand, and the other one is from Vietnam, if I'm not mistaken, Singapore, and myself. And we're conducting some research right now. So we're putting together a consensus paper where we're hoping to have about 150 responses worldwide for people who are using injectable type PN, polynucleotides, or injectable type PDRN. Because if there's no vascular occlusion, if there's no lumps and bumps or granulomas that occur, that's probably going to be a safer way to allow us to boost this skin, which is basically causing hydration of the skin. So I'm looking forward to that. I don't know if our colleagues know that Galderma is going to be putting something out early 2026 that's going to be a skin booster. So that's coming down the pipeline. That's been overseas in Europe for over a decade now. So the space is exciting.